Hello, everybody. This is Dr. Mike Carberry from Advanced Medical Integration, and I have a very special guest today I'd like to introduce to all of you. We have on the line with us, sharing this podcast, is Dr. John Rosa. Dr. John Rosa was on the board of NYCC, New York Chiropractic College, for 15 years, and for the last 3 of those years, he was the chair of the board. He also was awarded board emeritus, which was only awarded to 5 people in 100 years. Is that right, John?
Yeah.
Okay, so you can tell this is a very special person we have here. It's not your average run-of-the-mill person. He manages his own and owns 13 integrated clinics in the DC area, and he works with professional and Olympic athletes, as well as being in his spare time. Get a load of this. He's a surrogate to the White House Opioid Task Force. So he reports to the president, to the first lady, and to the cabinet. He's also a consultant to 3 state opioid task forces, as well as a consultant to the DOJ, a consultant to the Drug Enforcement Agency, and a consultant to Homeland Security. Welcome to the podcast, Dr. John Rosa.
Hey, how are you?
Good. It's always an honor to have you share a platform with me, and another one of those honors.
The honor is mine. I love the work you're doing. Yeah.
Thank you.
Yeah. Close to my...
That's how we kind of got attracted to each other. I think I saw a video of John speaking to the White House Committee, task force on opioid abuse, and he was addressing the cabinet members, and he had some very sane, rational comments to make. And I watched it, and I said, I have to talk to this guy. And so I don't know how I even got your phone number. I think one of my staff got it, and I called you, and you answered your phone. So I was very fortunate.
I have an inherent problem which is very similar to yours, that there's a letter N and there's a letter O. And when they get close to each other, they spell something. We really don't know what it is. I can't even pronounce it. But never say no. Never.
Good. Well, I'm glad you didn't. And I'm glad we had the chance to actually speak a couple times in front of our conventions at MI, which is usually about 500 people in the room. And then today, who knows how many people are going to tune into this. So thank you for being here.
You're welcome.
So I want to ask you a little bit about, when I first heard you speak, you started upgrading us or catching us up to speed on the condition of the opioid crisis in Washington. And when you did, I was pretty floored, as well as the other 500 people in the room. Would you care to do that for us now?
Well, yeah, the perspective of what we see versus what the government actually understands and is taking care of sometimes is on different planets. Not to say they're not doing their job and they're working, but statistically, I think the numbers are progressively getting worse, and we're just not paying attention to it well enough at a federal level. And I tell you, now that I'm there and working on the project, the bureaucracy is quite obvious. They all have very good intentions, but you have 100 layers to get an answer and actually put things in motion. So some of the things we discuss and talk about, you won't see until a year later, which slows things down. It's really why I like what you're doing and your work at AMI. It actually excites me more to talk with you than it does at the White House, because they're an aircraft carrier and you're a speedboat. You get your messages out to these people very quick, and we make some really good grounds in making a difference for society. Where there, it takes a while, but it's also important to do that. It's the cage.
Right.
When you're 5% of the world's population and 90% of the opioids that are consumed, that are made, that's a major red flag. Some of the stats say 5% of the world's population, 80%. The 80% stat is actually the opioids prescription medication. The 90% stat is all illicit and prescription medication, because most of the illicit heroin and fentanyl that gets consumed is in the United States. So the 90% number is actually there. And then 80% of those users of heroin and fentanyl came from a prescription medication to start with. So hence why we need people like ourselves taking the cage at the White House.
Right. So, my drive has been to change healthcare to make it more function-based, less symptom-based. And the reason I zeroed in on the opioids as a target or a goal to eliminate or to get under control is because exactly what you just said. I had a very close family member who was prescribed an opioid for an ankle injury, and not even a few years later, there I was trying to do an intervention with him to get him into Narconon to get off of heroin because they cut him off and he turned to illicit drugs on the street. And that has a good ending. Thank God. I'm going to his wedding in about 3 weeks. He straightened himself out. He became a counselor at Narconon. He's marrying, his wife was a counselor at Narconon, and they're very, very clean and happy and productive now in society. So it was a really good turnaround. But that's one out of how many?
Yeah. That's the problem, because statistically, it doesn't work out that way. Once they're at that level, the relapse is very high. It's a shame because we're in such a position, us as a group of professionals, and I say group, we're talking the integrative medicine. We're in such a position to make major change that not just the grassroots stuff that you do by reaching out to doctors to get their offices integrated, which is ridiculously important. And I could go into that after I make a statement. It's not just about the noise and the message that we do at a grassroots level, but at a federal level. We got to get into government and decision-making influencers to let them know that there's a few keys to prevent this problem before they get to the point of your family member having to deal with getting on withdrawal medication or a medication to come off of an addiction. It's absolutely so necessary. And I'll tell you, I'll give you an example. When I had a medical doctor's office that I did work with, we had a lunch meeting just to have a conversation about how things were going and the referrals. And he said, like, John, I don't think all the people I send to you are actually reaching you, because I don't get notes. Either you have a problem with your office getting notes, or they're not getting there. I said, no, it's definitely them not getting there, because I know we don't have a problem with getting stuff out. So he said, I wish you were here. It would make it life easier. So, of course, the guy doesn't know what no means. I said, if you have an extra room, I'll go there and I'll do a free clinic. Well, for 2 years, I did a free clinic in his office where anybody that had any pain-related issue, he just walked into the room, and they reduced their opioid prescription writing by 70% as a result of me just sitting there.
Wow. And that, to me, if you look at this problem, you go, what are the ways to handle it? And it seems like it boils down to 3 ways. And the one way is, using these drugs beyond their therapeutic value is illegal. If somebody's getting them without a prescription, or forcing a doctor to get a prescription, or they're buying them on the street, that's illegal, and that's a problem. So there's law enforcement, or they're turning to other drugs that are illegal. That's one. Number 2 would be, okay, so they got the drugs, they have the problem now, and they're addicted. What do we got to do to stop that? And Washington's paying attention to that as well. Is that correct?
Yes, they are, for sure. And there's money programs that would help people with addiction.
Right. But I think the way you and I think, and I think the reason we clicked off so much is we're looking at it going, who's stopping the prescription?
Yeah.
And that's the problem. So how bad, you floored me, and I don't think a lot of our listeners would know, how many prescriptions are being written?
650,000 prescriptions for opioids are written every day.
Every day. And I saw a stat recently, the number 1 reason for that prescription is back pain.
Number one.
So, of course, it's going to take some chiropractors to look at this and go, wait. There's better ways to do this. You don't have to jump into the most deadly way to do it first.
Yeah, and that's the cage that has to be shaken. I use a simple analogy. It's like a story that I tell sometimes, that I work with a lot of different doctors, and I'm friends with a lot of different doctors, but I go fishing at the same hole every Saturday with my best friends, an emergency room doctor, a primary care physician, and myself. We get to the hole that day at the edge of a major waterfall, and there are people all over the place, flat, going over the water's edge to their fate. The ER doctor already jumps in without saying anything, goes to the water's edge and helps as many as he can to not go over the edge, because that's what they do. The primary care physician's building a raft to go in the middle of the area and grab as many as he can so they can raft them, and that's what they do. And they're asking me, John, where are you going? And I'm swimming like an idiot as hard as I can upstream, and I'm saying somebody's got to figure out why they're getting in. They're either getting in or they're pushing it. So let me figure it out. You guys do what you got to do, but I'm going to stop more people from getting in there. It's really that simple. Like, you can't. And I was at a meeting at the White House, and we're 45 minutes into prevention, and all I heard was preventing death, Narcan, distribution of Narcan to our EMTs, to our hospitals, even the community at the CVS and the rest. I finally got up and I just have to excuse myself because this is useless. And they're like, well, Dr. Rosa, what are you talking about? I said, I thought I was coming to a prevention meeting. But you're talking about preventing death as it happens. I'm talking about preventing a problem that we have that's in existence.
And it's a completely preventable problem.
Right. I mean, it'll take a while, and we'll have to educate people on what to do. But what you're doing by implementing this combined. See, if we have a barrier with chiropractic in general to get the referral because of lack of understanding or trust, I get it. It's there. We're making headwinds with that. We really are making headwinds with that. But when you have an integrated model where there's medicine, chiropractic, physical therapy, even acupuncture, behavioral medicine, when they see that, then it's an easier referral pattern. 1, 2, it's a much higher success rate. So what I mean by that, a lot of statistics have shown that if chiropractic is used as an intervention, it decreases opioid script writing by 50, 55. I think there's one study that went a little higher than that, which is an absolute incredible statistic.
Right.
What I'm trying to prove in my model that I did by going into a primary care setting is that soon as you have medicine, chiropractic moving in the same roof, and everyone is taking it at the same time, your success rate of not prescribing an opioid goes to 70% or above. That's an incredible difference. That every single 5% move in a different direction is thousands and thousands of lives. So it's really, really important that everybody, insurance carriers, governments, decision makers, practitioners, big groups, hospitals, rehab centers, and just the practices that exist out there, if we don't combine efforts and have an integrative model, we're missing everything. We're missing it. Right. That's why when we get together and I saw your mission and vision, I'm like, whatever it is you need, let me know. I'll keep you up to date with some stats, things that may be a little bit newer, that may not be out there. Just like tag team and combine efforts, because what you're doing and what I'm doing is no different. I'm just screaming over there and you're screaming over there. It's a
well, we're doing a little more than screaming too. Like, I know that you're a doer and that you're not going to just settle. Like, if you run into roadblocks in one venue, you're going to go to another. So you work with 3 state task force. Tell us about that.
So for example, the state of Maryland. I spoke to the head of the task force there. I just went in for a conversation on a project that I'm working on with some Hollywood and entertainment figures in a nonprofit setting called Overdose Free America, to try to raise awareness. But it's going to be at such a high level that I approached a couple of state people that I knew I had some connections in. So I got meetings that we get in. But when I go in and tell the story of what the prevention model is, like we just spoke of, everybody wants you at the seat of the table because they're not hearing it. They're just not. There's a few people who talk about it, but in the decision-making room, there's not that guy that's saying, hey, here's probably one of the best prevention models that we have. And without that, you can go through legislative pieces and say we need more Narcan on the street, we need better law enforcement, we need more facilities to treat. I think everyone misses the boat, because if you concentrate on throwing millions of dollars at treatment centers, what that tells me is that it's perfectly okay to become addicted as long as we have enough treatment centers. So, let's stop talking about, and don't get me wrong, we need treatment centers, because one in 10 addicted can get help or find help. Part of it is stigma related, and the other is that there's just no place for them to go. So we do need it, but you can't have legislative conversations only about, see what they do normally, and what everyone does in Western civilization, we could stamp this on anything, is we need to stop the bleeding immediately, and we need it done yesterday. So when they are looking at the problem, it's just death. And when you look at a problem as just death, you're only fixing trying to not have people get a toe tap. That can't be. It can't be the answer. It's not.
Right.
You can save some lives, but you're not stopping the problem. And then what I like to do is, in getting into that task force level, is just have the conversation to say, do what you have to do, but do me a favor. Let's talk about legislation. Let's talk about rules and regulations to get stuff covered. Look, we were in practice in similar times. I went through that stage in the early 90s, where all of a sudden people who would get referred for treatment quite frequently, and it was covered by the insurance company, all of a sudden were on medications and not coming in as much or infrequently. So we had an increased writing of prescriptions and a decreased coverage by insurance companies by adding higher deductibles and co-payments. So what do you think is going to happen? Not covered, covered cheap medications. These pendulums swung in both directions. And between the 90s and today, we saw we're not getting. And then the doctor, and I asked him, I said, we're 70% reduction in you writing an opioid prescription. Just because I'm in the next room? And he's like, John, it takes me 3 minutes to write a prescription and 30 minutes to explain where they got to go for getting treatment when I don't give a prescription. And then when I give them that explanation, 2 weeks later, they come back and say, the place you sent me to, I can't afford a $50 copayment and I got a $10,000 deductible. Bammo, they get a prescription anyway. So we got a lot of broken. So to answer your question, which is a long-winded one about the state legislation stuff, I'm trying to push hard to get similar legislation on the book that happened in West Virginia, where the governor in West Virginia put a really incredible bill through. I think we spoke of that.
Yeah. So the way I understand that bill says if you're going to cover opioids in the state, he's talking to the insurance companies, you have to take away the restriction of getting these non-drug services. So they have to have a minimum of 20 visits covered in an integrated practice that covers chiropractic and physical therapy services and things like that.
Yeah.
Correct. That's great.
Because they went the farthest out of anybody, because the governor in West Virginia goes to a meeting with the medical association and pounds the desk and says, I need an answer. I'm getting stats that say 80% of heroin users started with a prescription, and the only place that comes from is you. Whether you gave it to somebody or it was diverted after you gave it to somebody, it was still written. So what do we do? And when the answer was, well, we try to send them somewhere, but it's never covered, so they keep coming back. We don't really have a choice. He got so razzled by it, they wrote the legislation and said, before you write a prescription for an opioid, you have to utilize integrated modalities such as chiropractic, acupuncture, physical therapy, behavioral medicine, mindfulness. I mean, they're even throwing these terms around now that we know work. And you have to cover it. If you're going to sell insurance in my state, it has to cover 20 visits. The co-payment is the same as a primary care physician. No deductibles can apply. And then, oh yeah, they don't need a referral. If they want to go, that has to be covered on their own. That was the most sweeping piece of legislation that happened. And if that happens, now there's 9 other states that are trying to get similar wording in. And let me tell you something, if that cascades, if we get legislation like that and educate the community on why it's important to have integrated models and medicine, we don't have enough schools that could put enough chiropractors there fast enough.
Well, we do have a client, a doctor who is treating the assistant governor of his state. And they actually passed some legislation. I don't know if I want to mention the state. Maybe if you know anything about it, you can chime in. But the bill says that he said I was talking to him at a conference recently, and he said when he was talking to the assistant governor, they found out that they would say to doctors, why aren't you writing prescriptions to chiropractic or physical therapy? And they go, because there's limitations on their coverage. They go for 10 visits and they're back in for a prescription. So the bill said you have to remove the limitations on those services in our state.
How simple.
You know what I'm talking about?
How simple. I know what you're talking about. I don't know if it's out there yet, though. See,
that's what I don't want to say.
Yeah, once the legislation passes, then you could just add them to the list and show the rest of the world that they're making the change.
What an amazing thing that is, oh, you have to remove the limits on chiropractic and physical therapy if you're going to cover opioids, because they can't get that. See, I do truly believe the drug companies look at chiropractic and physical therapy as their true competition, and they legislation passed to stop our coverage. As no effectiveness or abuse or whatever, all this trumped up stuff, just to stop people from going our avenue.
Well, you know, the lawsuits that are coming through, especially with Purdue and the Slacker families, are getting written up about that. I am so happy that there's 100,000 lawsuits hitting that company, and not because, you know, even though to me, they're the devil in disguise because they're just happy to kill people. But the information that's going to come out of what they're in investigative process are emails and documents and the rest. And you're seeing them talk about how they could care less, and that they actually were pushing and lobbying for cheap coverage of medicine as opposed to treatment. It's actually starting to come out to prove our whole point. And now they even went as far as saying, well, yeah, whoever does get addicted to this stuff, make sure that the message is that they're just criminals. They're bad people and criminals. Like, they actually are part of this stigma process that they landed on everyone to say, well, the ones who do get addicted, let's just label them. I mean, it's really unbelievable. So hopefully,
it is unbelievable.
Yeah, once that starts to turn and the rest of the population says, man, I didn't, you know, when you walk by somebody who's on the ground with their head in the bushes, obviously overdosing or just in a very bad high, if you walk by that person and say, look what you're doing to yourself, instead of saying, look what we did to you.
Right.
My wish is that those two things being said can be flipped around. Because the minute you say, now there's a stat that 68% of our entire population in the United States, when you ask them who's to blame, they say the people who are taking the drugs. That's not fair. It's not fair. If 80% of the people who are using heroin started with a prescription, you cannot point the finger to these poor souls who got duped by a system that was supposed to protect them and made them go down a path of misery. It's not fair. So if we're doing the things we do and getting the message out of where the problem came and the political strife and the companies that started and the rest, if it just does one thing, take the stigma off of the blame on the people and says, they're the blame, they're not. You know how many lives you saved?
A lot. You know, I'll tell you, for my birthday, my wife bought me a fishing trip in Oregon, and it was really exciting. We go out off the beach, and we go through the waves, and then we get out there fishing. There was like 3 other people on the boat. One of the people on the boat was a woman, and I'm standing next to her, and I get talking to her. What do you do? And she's a prison guard in Oregon, in the state of Oregon, and she's been a prison guard for like 20 years. And I said, well, how's that? And she goes, you know what? She found out I was a doctor. She goes, what kind of doctor are you? I said, a chiropractor. She goes, you know, let me tell you something about what we've noticed about healthcare in prison. The population in prison in the last 10 years has changed dramatically. I have not seen so many white collar and middle class people in prison, drug offenses because of opioids. Well, that's without me even talking about what we're talking about. She just brought that up. That's her observation as a prison guard in the prison system in Oregon. That's out of control, totally out of control.
I mean, think about the process that takes you there. So you get prescribed the medication, you ramp up because you're getting used to it, you keep getting prescribed the medication. Now your body systems probably don't even need it anymore, but your brain says it does. You're chemically dependent, you need more and you need more. Then the doctor gets scared and says, we got a crisis here, we can't prescribe you this anymore. And then they're buying it for a couple of dollars a milligram on the street, and they have $300 habits. And this little baggie is $5. So while they're getting, they will I will never do heroin. You won't see me behind a dumpster with a needle. So that gap between dumpster and needle and a $300 habit is robbery, theft, taking from your family, your friends, and eventually something bad. That's why you see the prison system escalating so much with these people, because in order to keep that habit, they don't have a choice. And again, you can't blame people who were pushed in the water before they get to the waterfall.
That's right. That's exactly right. And you know, when I heard you talk about the study, and I did some research because I have a book coming out in the spring about healthcare, and we have you know, a chapter on the opioid crisis, and the study to say it was not addictive was 38 people.
38.
So I'm going, all right, I know it didn't start that way. And I know from having family members that work in the pharmaceutical industry that they employ people who can do DNA testing of drugs to do a swab and test your DNA against different drugs that are going to be tested to see if you're a candidate for a reaction. I'm sure that number went from like 1,000 down to 38 when they got the 38 people who wouldn't get addicted, and they still got 3% addicted. So there's no way you can tell me with the crisis we're seeing, only 3% of the people get addicted. That is just not even feasible.
No,
so it's got to be done.
There's a lot of overlying things. The deeper that, you know, when you're asked to be a surrogate at the White House, a lecturer all over the country, the Department of Justice, and this and that, I'm almost forced. I'm not saying this out of conceit, but I don't know anybody who really is understanding and gets this problem as much as I do, because now I'm forced to talk about all of the facets of it. Because now I have to be an expert. I was an expert in integrated medicine and chiropractic in the field of holistic health, but now I'm going to know it all, because when you're on the stages, you don't have a choice. This overlapping of the mental health problem, and here this kind of full circles back to what you did. So you have a healthcare system that's changing over from a doctor-patient relationship, knowing you like a family member, and understanding what your healthcare needs are when your spouse passed away, when your child failed out of college, when you lost your job for the third time in a month. Nobody knows that information anymore. And when you have a slight bit of anxiety or mild depression for a result of life, which is who doesn't have it, and right. you twist your ankle and you go to get that prescription, cortisol just pushed every normal dopamine and serotonin, oxytocin receptor. Cortisol said, you guys get out of here, I'm taking over. So when you take that medication, it fills the brainstem up that hasn't been filled with its normal chemical, and it makes you feel like, you know, we call it the I don't give a hoot. It's not a high, it's I don't care.
Right.
When you don't know when you don't have that relationship and you don't know who's sitting in front of you, you should know, you know what, I'm giving you an anti-inflammatory and muscle relaxer. There's no way I'm going to give you this because you're not in a good place right now. Like, how do we not know that? That would take half of our problem with this and throw it in the garbage. Now, the way the system now is set up, all these doctors are getting gobbled up by big practices, hospital groups, and all the rest. No interaction relationship. They got to see X amount of patients per day, or they don't get paid. And you can't know what's going on with your patient. But when you have a small office settings that triage a patient for anything that they may have, in combination with a couple of different specialty providers, you don't have a choice but to know what they're about and what their life's about. You could easily make the separation of you can handle it, you can't. Now, the drugs were made for a reason. So I get into a car accident and half my legs falling off. If you don't give me morphine at the hospital, I'm going to hurt somebody while I'm there because it was paid for that, right? But if I go into the twisted ankle and it's really bad, do you really need to give me Percocet or OxyContin, especially if in my history I just lost my job for the third time last month?
Right.
You know, come on. Let's just pay attention. Let's just pay attention.
Right. Unfortunately, there's these products to be sold and products to make money off of, and that's what drives a lot of the industry.
All of it.
So, you know, I mentioned earlier about you're always finding these other avenues to pursue, and you're working on a project. You mentioned it for a second, Drug Free America. Would you like to talk about that for a second?
Yeah, it's Overdose Free America.
Overdose free. Sorry.
Yeah, and it's the cycle of things that I've been doing, and a chapter in a book with Jack Canfield that I wrote, and an interview that I did with him, and some other stuff, and a white paper, and then at the White House. You're kind of floating around in that space. And there's some movie directors that are doing some stuff in this world in Hollywood that caught the eye, and they approached me to create a PSA style thing that will get this to design to get the stigma off of the problem and point the finger in the direction of where it came from and not the people who were using that are the problem. So of course, just based on the stuff I do where my passion lies, I jumped right in. And it's going to entail a professional Hollywood level, and in the entertainment industry and music, it'll actually have people at that level involved too. In fact, Andrea Bocelli, who's a name that most people know, is signed on to help. We're getting some big names and the movie directors that are in film. It's going to be something else, and it'll give me the platform to be able to get the message out of stuff that's going on, especially the type of stuff you're doing, what your group is doing. I know I keep saying it, but I'm just you. I mean, you're a blessing. You're totally a blessing. And the people that follow you and learn from you and understand are just like, you know, we need to multiply that 1,000 times because it'll fix things.
Same about your efforts as well, because, you know, you're a rare person. I don't meet many people like you. So, yeah, I mean, where do we go from here? I mean, education of the public is definitely key. We got to get this out to the public so that we get enough emotion elicited from the public that they demand a change. I mean, that's basically how you get change.
Yep, absolutely.
I think what you're doing is phenomenal along those lines. I'm glad that you've included us into part of that to help you do that. You're going to be coming to our convention in April. Is that true?
Yes, I am.
Twist your arm a little bit?
No, because like I said in the beginning, I don't know the letters N and O make a word that I don't understand. It's not in my vocabulary. So if I get a chance to explain to people, you know, not only where did this problem come from and what's happening in it, but how to be part of the solution, then I'm not doing my job.
Well, I've said this to you before. I'll say it again. If you ever need my help in anything, you just pick up the phone. I'll be there in a second. And we are working very hard in getting some of the bigger names in chiropractic to support your cause. We do have a number of board presidents that are clients of ours. So, and you've spoken to some of them and have been working with some of them. So anything we can do to help is what we want. And for our listeners out there, if you're not aware of this problem, you should be. If you're in healthcare, if you're a doctor of any kind, you know, if you're not doing something to stop this problem and stop these prescriptions, I'll be pretty blunt. You're part of the problem.
Yeah.
And let's not be part of the problem. Let's be the solution. That's what I. Is there anything you'd like to add before we go?
No, I'm glad we had a time to have the conversation. It's great information, so I'm glad you're putting it out there. You know, the more that know, the more that understand. Education is key, because the things we're talking about, a provider that listens to this can take it to another provider and make them understand, or just the general public to get their eyes on it and say, wow, I had no idea. Then we hit a home run.
Right. Well,
I like
John,
being on your team, buddy. I like being on your team.
I appreciate you giving us some of your valuable time today, and hopefully we can steal some from you in the future and do maybe another one of these podcasts as things change in Washington.
Absolutely. Absolutely.
All right. Thanks. Take care.
You're welcome. Bye-bye.